Hello, welcome back to my channel. It's been a while, but anyways, I promise for the last time I'm actually here to stay. So if you're new here, welcome. My name is Joannes, and on my channel I talk about my journey. So before it was my journey through nursing school, but now it's my journey as a nurse. And also, as a previous international student, sometimes I do talk about, my experiences and, some things is relating to immigrants in Canada. So if you like what I'm all about,
like, subscribe, share.
In today's video, I will be talking about how to become an operating room nurse here in Canada. So when I was actually playing around and thinking of what type of nurse that I wanted to be, I did not see anything on how to be an operating room nurse or even what it was all about. At least from the Canadian side, there was nothing at all. So anyways, I decided to make this a diary series, I'll just document my own journey. Hopefully it can help someone else. So first, what is an operating room nurse? They're basically nurses that work in the operating room. Now, there are two main roles an operating room nurse assumes when they go into work. So I'll just briefly go through them. So the first one is a scrub nurse, right? I'll tell you both of them. It's a scrub nurse and a circulating nurse or a circulator. So a scrub nurse is what would typically come to mind when you think of an operating room nurse. So if you picture them, they usually have that like blue or green sterile gown. The scrub nurse is basically up there in the sterile field with the surgeons, and they're usually like passing instruments. If there's anything that needs to like be prepped or prepared, the scrub nurse does it as well before they hand it off to the surgeon to use. So basically that's their role. There's so much more to it. I'm just simplifying it, but they're usually sterile. So that means they cannot leave, to grab something. And now that is where the circulating nurse comes into place, which is the other role that you can assume in the operating room. Now, the best way I can describe a circulator or a circulating nurse is picture a chicken without its head running around. That's basically what a circulating nurse does, running around. So if they need anything, it's your job to like go grab it. The circulating nurse is also in charge of like documenting or charting basically everything that happens in the surgery. So what time the surgery starts, what time it ends. Also the instruments and tools that I used and devices that I used during surgery, they all need to be documented. If there's an implant as well. Also, if there's specimens, usually there's specimens in surgery. It's the circulating nurse that takes them to the pathology lab. Another role a circulating nurse, again, depending on the hospital. In my hospital, the circulating nurse also helps the anesthetist or the anesthesiologist. They also help with like intubating patients. So maybe like helping the patient with like the oxygen mask and inflating the cuff of the balloon and all that stuff, right? And they also check in the patient. So before surgery, you have to ask patients a series of questions like, what's your name? Make sure it's the right patient, make sure it's the right procedure, that the consent has been signed by the patient, by the surgeons. Make sure the patient hasn't had anything to eat. If there are any allergies, these are things that the circulating nurse is in charge of, obtaining that information and relaying it back to the rest of the surgical team. Yeah, there's so much more, but basically that's the general gist of things. So even though there are like two roles that you can assume as an operating room nurse, you can only assume one role at a time. So let's say you have a surgery, let's say hysterectomy. You're either a circulating nurse or you are a scrub nurse. You cannot do both at the same time. That being said, even though it's still the same surgery, you can switch, right? You can go from being like a scrub nurse to like a circulating nurse, and vice versa. But usually we don't, unless, if someone goes on break, let's say you've been a scrub nurse for a while and it's time for you to go on your break, then the circulating nurse can, take over for you, and then they scrub and become a scrub nurse, and then you can go on your break. So that happens, but at a time, you can only assume one role. All right, so that's pretty much the gist of things and, about being an operating room nurse. So next, I'm going to talk about how does one go about becoming an operating room nurse here in Canada. So first thing, you have to be a nurse. So to be a nurse, you need to have graduated nursing school, and then you need to have written the NCLEX. Now, this is specific to some hospitals. Some hospitals will allow RPNs to also be operating room nurses. Some of them may not. My hospital, whether you're an RN, a registered nurse, or an RPN or LPN, you can be an operating room nurse. The only difference in my hospital is RNs can circulate and scrub. So we can assume both roles, but the RPNs can only scrub. So they do not circulate. And that's for my hospital. I don't know if it's the same in other hospitals. Now, the second thing is most hospitals, to become an operating room nurse there, they do require you to have completed the perioperative course. So you need to have that certificate. And one way to go about it is by enrolling pretty much at any college or university that's offering that course. It's usually like colleges that offer it. Now, here's the catch. This is a course that you need to take as a nurse. So you cannot take it while you're still in nursing school, or at least I should say most of them, they do require you to be a nurse. So if you're wondering, oh, I'm in nursing school, should I just go ahead and just take this course on the side? Most likely no, you do need to be a nurse first. And then after you've completed this course, then you have that certificate. So it's usually a 1 semester course, and they pretty much teach you the basics of what it is to be an operating room nurse. They teach you about sterility. There's also some education on anatomy, physiology, understanding, some surgeries and procedures a little bit more. Also, they teach you how to pass instruments, because honestly, I used to think when I used to watch Grey's Anatomy, right? When they're like, oh, scalpel, like, you just give it to them. But no, they're like proper ways to like pass instruments to the surgeons. So they teach you all of that in that 1 semester perioperative course. Now, after you've, satisfied the requirements of the course usually has like a theory part and also a clinical component to it. So after you've completed that and then you have the certificate, then you can go and, I guess, apply to hospitals to become an operating room nurse. Now, some hospitals will sponsor you or sponsor nurses to get this perioperative course. So meaning that they will pay for the course for the nurses to get it. Some do, some do not. So if you're interested, it always helps to find the hospitals that are willing to pay for it, because then usually if they pay for it, then you're hired on as an operating room nurse for that hospital. So that is one way to go about it. If you can't find any in your area, then I guess you can pay for it yourself, complete the course, and then apply to different hospitals. Most hospitals, a lot of hospitals do, when they're hiring operating room nurses, if you look at their job, the job posting, they usually say stuff like, oh, it needs like 2 years experience or prior experience. And, some of them are specific like that. There are also like some hospitals, very few, that will accept new graduates or new grad nurses into the operating room. I was lucky to have found one of those hospitals. So if you're a new grad nurse, I'd say take advantage of it if you're interested, So, but yeah, that's pretty much it about how to become an operating room nurse here in Canada. Let me know if there are any other videos or any other thing you'd like to know about the operating room. Like I said, I'm trying to make this like a diary series. So fingers crossed, we'll see how it goes. But hopefully this helps. All right, thanks so much for watching. Until next time. Like and subscribe.